In most cases, pulse wave velocity studies are performed to assess the stiffness of the aorta, measuring the speed of the pulse wave between the heart and the carotid and femoral arteries. Please refer to your study protocol to determine which pulse locations must be measured. Before beginning pulse wave velocity assessment, place the patient in a supine position and allow 5 minutes of rest. If you are measuring the carotid pulse, remove any pillows and make sure you will be able to tilt the subject's head back. Plug the blue ECG cable into the Cvms module. Apply fresh ECG pads onto the subject, using either of these configurations. Clean and, if needed, shave the skin in the areas of application to assure secure skin contact with the ECG pads. Palpate and mark the pulses that will be used in performing the pulse wave velocity test. To find the carotid pulse, tilt the subject's head backwards and away from you, and use the tips of your fingers to locate the strongest pulse. Mark this location with a felt pen. Arrange the subject's clothing to expose the femoral artery. It may be helpful to position the subject in a frog leg position. Palpate the femoral artery and mark the point of strongest pulsation. To begin the pulse wave assessment, start with the patient screen. Click on the PWV button located on the left side of the screen. Now click on the Study button. The PWV study screen will appear. Enter the first pulse location you will measure as Site A. Enter the second pulse location you will measure as Site B. In a carotid to femoral pulse wave analysis, Site A would be checked as carotid, Site B as femoral. Place the tape measure at the suprasternal notch, located at the top of the sternum. Carefully lay the tape measure down the center of the body, tracing the path of the aorta. When you reach the umbilicus, angle the tape to reach the chosen femoral pulse location. Enter the distance in millimeters from the suprasternal notch to the femoral pulse location in the distal box. If your tape measure is in centimeters, you must multiply the results by 10 before entering the distance. Next, measure the distance from the suprasternal notch to the carotid artery pulse previously marked. Enter these results in the proximal box. Remember to multiply the results by 10 if your tape measure is in centimeters. Take the subject's brachial blood pressure measurement using careful technique. Enter systolic and diastolic blood pressure into the appropriate boxes. Check your study materials to determine additional information that should be entered into the medication, notes, height and weight, and operator fields. The capture time in seconds and PWV algorithm boxes should be left in the default settings. To begin the analysis, click Capture Data at the upper right-hand corner of the PWV screen. Examine the quality of the yellow ECG tracing on the screen. The spike of the R wave should be prominent. A small amount of artifact is acceptable as long as the QRS complex is tall and clear. If you notice that the ECG signal is poor, make sure that you have applied and placed the leads correctly. If so, try another lead configuration. Now use the tonometer to record 10 seconds of pulse waves at the pulse you have identified as Site A. In carotid femoral assessment, this is the carotid pulse. It is critically important that the foot of the pressure waveform, the location at the base of the large upstroke, be as clear as possible. Try different angles of the tonometer to produce the smoothest possible waveform. When you see 10 seconds of smooth waveforms crossing the screen, press the spacebar to record the data. The screen will direct you to perform another test on Site B, in this case the femoral artery. Once data capture is complete, the PWV report screen will appear. To determine whether or not the measurements just taken conform with quality control requirements, review your study materials. In most cases, both values in the standard deviation (SD) box must be displayed in green. In most cases, the plus or minus error must be less than 10% of the PWV value. If the test must be repeated, click on the Study button to review study details. Then click on the Capture Data button to return to data capture. To print the PWV report, click the Print button. Cvms PWV assessment is complete.